Hi, everybody. Thank you for joining us. We're going to go ahead and get started. So today's topic for our legislative webinar is going to be on some federal and state legislative updates, as well as some background information on the SNAP program, as well as some specific threats that we see to the program. So on today's call, I'm Anthony Alfano, our Public Policy and Advocacy Coordinator here at the Food Depository, and my co-presenter and partner on today's call is Alicia Huguley, who is our Senior Director of Public Policy here at the Food Depository as well. So as I was saying, our agenda for today is going to include some policy updates at the federal and state levels. We'll also give a very brief overview on SNAP and what the program is. And then we'll get into a little bit more specifics on the program, and then some threats that we see to the program as well. Those include block granting, some work requirements, and restricting choice. So why don't we get started with some federal policy updates? So we want to give you kind of a broad overview on some the federal landscape. The biggest one that we wanted to talk about was the Farm Bill. So the Farm Bill is the massive federal budget at the U.S. Department of Agriculture, and what it does is it sets food policy that supports some pretty critical nutrition and agricultural programs. The biggest part of the Farm Bill is two parts. The first is the agricultural piece, and the second is the nutrition piece. And historically, those have been kept together as part of one bill, and we here at the Food Depository have been advocating to make sure that those two parts remain one and the same, and that they're not separated out. We feel that if those two parts of the bill were to be separated out, that it could cause some concern from nutrition programs, including programs like SNAP, which we'll get into, that would give us some pause for concern. So what the bill does is, it sets policy and support for some numerous critical programs like SNAP, like some other really critical nutrition programs. The current bill is set to expire in 2018. Right now, there are some hearings taking place on the bill, but an actual Farm Bill itself won't be voted on until 2018 should a Farm Bill be approved by both houses of Congress, as well as signed into law by the President. So that's kind of just a very broad overview of the Farm Bill. Some other things that we're taking note of at the federal level is the proposed cuts and the proposed budget that we've seen that's been presented by the White House. And these are really critical programs that give us some pause that we've seen come out of this proposal that we wanted to make note of so that you're all aware, and something that we'll be monitoring as the negotiations and the conversations continue with the budget. So a lot of these, when we say reductions or cuts, a lot of it is really eliminations. So as you can see, when we say a $200 million reduction in WIC, which is the Women, Infant, and Children Assistance Program, that is a detrimental cut and effectively would eliminate a lot of the support and assistance that comes out of that program. In Illinois, more than 210,000 people benefit from WIC services. So a $200 million reduction, again, would be pretty detrimental to a lot of those recipients. Something that we're also taking note of is the community development block grants and a $3 billion cut or effective elimination of that program. Community development block grants have a lot of variance in what they do, but specifically here in the city, we utilize just over $1 million in community development block grants to provide emergency food assistance programs to 150 of our food pantries and shelter program partners here at the Food Depository. So cutting $1 million right out from the city of Chicago would be a huge negative impact for those pantries and those partners. The other couple things that we're looking at is a $771 million cut or elimination in a lot of the programs that come out of the Corporation for National and Community Service. That service program are things like AmeriCorps or VISTA members or other community service-oriented programs. 13,000 of those are people who participate in those programs in Illinois. We have a number of AmeriCorps and Vista members here at the Food Depository, and a $770 million cut that would eliminate a lot of the funding or all of the funding for those programs would have a detrimental impact on the capacity that we have here at the Food Depository, but also across the state of Illinois and the country as a whole. So those are things that we are definitely monitoring, and something that we here want to make sure that our people are aware of, and the effects that they would have in terms of the cut and the eliminations that they would have. Finally, the $3.4 billion cut in the Low-Income Housing Energy Assistance Program, or otherwise known as LIHEAP, that effectively eliminates that program. And what that does is that provides assistance and support for low-income and elderly people who need assistance to pay for their energy bills, so heating, electricity, gas. In the most recent data we have from 2014, over 350,000 households in the state of Illinois receive that assistance. And this is something that here at the Food Depository, while some of these cuts and eliminations to these programs don't directly impact hunger, they do have an indirect impact on the way people are able to fight food insecurity and hunger in their lives. So when we're looking at these cuts that to these programs that may or may not directly impact hunger and anti-hunger programs, they do impact the way that a lot of the clients that we serve are able to, the way that they're able to choose between putting food on the table or paying for their energy or their medical bill. So these are things that we definitely monitor here at the Food Depository and want to make sure that people are aware of their impacts as well. The other thing that we want to kind of underline is the overall cut to the Department of Agriculture. There's been a proposed $4.7 billion blanket cut to the budget, which includes a lot of the programs that we have talked about. We don't know the specifics in the entirety of that cut, but something that I do want to stress is that the entire USDA budget is about $24.6 billion. So a $4.7 billion cut in the budget would be approximately 20% of the entire USDA budget wiped out. That could have detrimental impacts to a lot of the programs that are very vital to the work that we do here at the Food Depository, but also to a lot of the programs that people benefit from and need access to. So as these conversations are going on, there's going to be somebody who kind of takes the helm of the Department of Agriculture and who's really going to be leading the charge, hopefully a charge that will benefit a lot of the advocates and the work that we're doing. And that is George Perdue, otherwise known as Sonny. So Sonny Perdue is the former governor of Georgia. He served in Georgia as the governor from 2003 to 2011. He was recently confirmed by the U.S. Senate as the next Department of Agricultural Secretary, and that was actually this past week on Monday. His vote was a pretty wide margin and had bipartisan support of 87 to 11. From our research on Mr. Perdue, he's a pretty middle-of-the-road guy. When the vote took place at 87 to 11, it wasn't that surprising. Just to take note, he was actually the final cabinet appointment to be confirmed of all of the appointments nominated by President Trump. So, you know, when we're talking about, you know, having a seat at the table and getting into the negotiations and presenting a budget for specific departments, unfortunately, we're a little late to the game in terms of having somebody at the helm of the Department of Agriculture. But, you know, a lot of coalition partners and a lot of people have been monitoring what's been going on. So we feel we have a pretty good foot in the door there. During his testimony, and I won't get into it too much, I just want to kind of go over his 4 broad goals. And when I say broad, they're very broad. The first is that he wants to maximize U.S. agriculture and agribusiness sectors and their ability within the USDA. We kind of took that to mean a little bit of deregulation, really promoting the agribusiness sectors and cutting a lot of what, you know, for lack of a better term, the red tape that exists within those sectors. He wants to prioritize customer service at the USDA and ensure a safe and secure food supply. Nothing pretty controversial about that. We'll see if there are any specifics that kind of come from the work that he does at the head of the department. And the other thing that we want to take note of is in his testimony, he said he wanted to safeguard the trust between private landowners and the stewardship of natural resources. There's always a tension there between the resources of the federal government as well as those of the private landowners. So just kind of monitoring what he actually meant by that and you know, seeing if it translates into any specific policies or any specific bills. We'll be monitoring that as well. So as he's a pretty middle-of-the-road guy, like I mentioned, there are a few things that we're just unsure of, and they didn't come up in his testimony, and we're not sure where he really stands. We don't know what his stance is on SNAP, on federal nutrition programs, or on other meal programs, or on WIC, or specific dietary guidelines or restrictions. So those are things that we wanted to take a look at. The other thing we're unsure is what he believes the entire role of the USDA to be. Is it more focused in the agricultural side, more focused on the nutrition side, on both, on neither? So we want to definitely make sure that we're monitoring that as well. But just to give you kind of a background on Sonny, those are the things that we're going to be taking a look at as he takes helm of the USDA. The last thing at the federal level that we want to get into, and like I mentioned before, these are things that may or may not have a direct impact on hunger, but they definitely impact the way that our clients are able to provide food and a nutritious and adequate diet for themselves and their families. So if you'll recall, back in 2010, the Affordable Care Act was passed and signed into law by President Obama, otherwise known as Obamacare. And since then, a lot of the conversation has been from the opposition. The Republicans in Congress have been wanting to repeal and replace the bill. And for the past 7 years, we haven't actually known what repeal and replace meant, but they kept promoting that as what they wanted to do to the bill. So with the recent election, the Republicans did gain control in both houses of Congress as well as the White House. So there is a pretty good period that we saw repeal and replace actually having a very real chance of taking shape. So in March, we did see a replacement bill come to the House of Representatives, and what it did is it effectively ended Medicaid expansion, which would have harmed millions of older adults, people with disabilities, and children. Over the next decade, it would have kicked about 24 million people off of health insurance who currently have it, and it would have reduced a lot of the requirements that came out of Obamacare and a lot of the really good provisions that came out of it, like students who up until the age of 26 staying on their parents' health insurance and some other things that came out of it. So within about 10 minutes of that bill, the Republicans pulled it from the floor because they did not have a vote. And as Paul Ryan said on that date, on the 24th, that Obamacare is and will be the law of the land, and so far it still remains that way. Until recently, this past week, we hadn't heard anything, but we do have a new amendment. There has been reports of a new amendment that has come out, and they're dubbing it the MacArthur Amendment. Tom MacArthur is a Republican from New Jersey, and he's a member of the Two-State Group, which is a very informal, moderate Republican group. They were a group of Republicans who could not sign on to the original repeal and replace of the American Health Care Act. And he, along with Mark Meadows, who is the House Freedom Caucus chair, which is the Tea Party caucus in Congress, they created this MacArthur Amendment to the Affordable Care Act, the Affordable Health Care Act. And what this does is it allows states to opt out of Obamacare regulations, like things on essential health care benefits, community rating requirements, and the amount older and or sicker Americans charge for coverage. What's interesting about it is that it only for states to opt out of these provisions. It gives them a way to opt out, and they only have to provide one of 5 ways to get a waiver to opt out of the Affordable Care Act provisions. Those are things like they have to propose a reduced average premiums for coverage, to increase enrollment, stabilize the market, stabilize premiums for individuals with pre-existing conditions, or increase the choice of healthcare plans. So not a lot of specifics that we've seen, but only one of 5 would states need to do to opt out. There have been reports that this new amendment and this new bill would kick off more than the original American Health Care Act would have kicked off. Some are saying upwards of 30 million people over the next decade could be kicked out of healthcare insurance. So like I said, what this means right now is that the Affordable Care Act is still the law of the land. We're going to monitor with our coalition partners in the healthcare advocacy sector what happens with this amendment and this new bill. But you know, things could happen like the undermining of the ACA through administrative efforts, so not providing the funding necessary for the marketplaces or the subsidies that we want to continue to monitor as the healthcare conversation takes place. The last kind of update we want to give is at the state level. So there are two things that we're monitoring and that we're looking at the state level. So right now there is a bill that's moving through the state legislature known as the Food Assistance for Hungry Students in Vocational Programming, vocational programs. So as many of you know, the cost of higher education continues to rise, but the availability and access to financial aid has steadily decreased. And what this does is that it ensures that those who are potentially SNAP eligible and who are low-income adults that pursue a Perkins Pathway career or technical education certificate at a community college would be able to become eligible for SNAP. What this also does is that any university or college that is a recipient of MAP funds would be required to notify those students who are receiving MAP funding that they are potentially eligible for SNAP benefits. The effects of which could have increase over 40,000 students who are eligible for SNAP across the state of Illinois. Right now, the bill has moved through the state house with a vote of 85 to 25, and we're expecting a hearing at the Illinois Senate relatively soon. We don't know if the governor, should it get to his desk, if he'll sign it, but right now it is working its way through the legislature. The other thing that I'm pretty sure all of you are very aware of is the budget stalemate, which is pretty historic. So for the past 2 years, neither the governor nor the state legislature could come to an agreement on a budget or any reforms that would be supplemented with that budget. So over the past 2 years, we haven't had a budget, and it has had a very adverse effect on a lot of the social service agencies across the state, many of whom we partner with and work with on a daily basis. There is current legislation moving its way through the House that has been dubbed a Budget Lifeline Bill, otherwise known as HB 109. This bill provides emergency funding for human services, things like higher education, community colleges, MAP grants, HIV and AIDS funding, breast and cervical cancer programs, and other violence prevention programs. So this is something that we definitely want to see make its way through the state legislature and make it to its way to the governor's desk and to be signed into law. Ideally, we would like a budget, but right now that's what's moving through the State House. So we want to continue monitoring that as well. Something to take note of is a lot of the partners that we work with have a backlog of bills, and they are unsure if the state of Illinois is going to be able to pay that even with a budget that gets passed. So when I say it's negatively and adversely affecting a lot of these agencies, it's not that they're just not receiving the money. They're not sure if they're going to be receiving the money that they haven't received in the past over the past 2 years. So we're going to get into SNAP a little bit now, but before we get into that, I wanted to kind of give a foundation for everybody about what hunger looks like in the state and then in Cook County as well. So a lot of our fellow Illinoisans have trouble putting food on the table and affording an adequate and nutritious diet. 11.1% of our households have some sort of food insecurity or struggle to afford an adequate diet. Just over 13% of the population lives below the poverty line. Almost 19% of children live below the poverty line in the state of Illinois, and 8.5% of elderly adults live below the federal poverty line. So what that looks like, a lot of SNAP recipients and SNAP participants are very low-income people within the state. If you look at the share of those within the most recent data we have in 2015, 40% of those had an income between 51 and 100% of the poverty line. 46% had an income at or below 50% of the poverty line, and 14% had an income above 100% of the poverty line. So when we're talking about those who are recipients, we're talking about very low-income people who are receiving these benefits. What does that look like in Cook County? I won't read through all of them. You have them on your screen. But 50% of the clients that we serve here at the Food Depository include one person who has been employed in at least the last 12 months. 91% of our clients have a roof over their head. And some other data, 36% of clients are households that include an older adult. So just to kind of give you a picture of the population of the clients that we serve. Now, if you look to the map that we have at the
I'm going to pause you. I'm seeing the chat come in. It looks like nobody's seeing the presentation based on the chat. So, let us just pause here for a second and figure out where that technical issue might be happening. We're not sure why the slides are not advancing, so we're going to pause here for just a second and see if we can get that figured out. All right, I think we apologize for that. I think we might have fixed it. Can folks just pop into the chat because I think folks are on mute. Yes, now I can see the screen. All right, sorry about that, everybody. It was visible on our end. We couldn't see it on yours. Thank you for letting us know. So go ahead, Anthony.
We'll continue, and then just as a note, we will make the slides available as well, so you will have access to the information, and a recording of it will be available as well, so it should go along with the screens. So kind of getting back into it, if you look at the map to the right, you'll look at the food insecurity rates across the city and across the county. The darker shades of green indicate higher rates of food insecurity, and the lighter shades of green indicate lower rates of food insecurity. Something that I want you to note that's pretty crucial to the conversation is that nowhere in the city of Chicago, nowhere in Cook County, nowhere across the country is there a county or community that does not face some sort of food insecurity. From the wealthiest to the poorest counties and communities across the country, there's some form of food insecurity. So as the conversation kind of continues, we want to make sure that people have that understanding of what food insecurity looks like, not only in our neighborhood, but across the country. So let's get into SNAP. So what is SNAP? SNAP is otherwise known as the Supplemental Nutrition Assistance Program. You may have known it as food stamps. Is the nation's most important anti-hunger program that we have. It provides benefits to low-income individuals and families. It's the largest of all of the domestic hunger safety nets that we have, and it has largely eliminated severe hunger and malnutrition in the U.S. A little bit of background on SNAP. In 2008, the program was changed from the food stamp program to SNAP, and it was also changed to the Health and Nutrition Act. A lot of that was due to end a lot of the stigma that existed around food stamps and those who received it. So they wanted to change that to kind of end a lot of the stigma that existed around the program. Something that we promote here at the Food Depository that we think, and I hope that you'll get from the rest of the webinars, Alicia kind of goes into more detailed specifics on SNAP, is that SNAP is important, it's effective, and it's very efficient. These are things that, this is a program that has made wide strides in ending hunger and ending malnutrition in the country, and I think when we go through the rest of the webinar, you'll get a sense of that too. So who does SNAP reach? So in the state of Illinois specifically, about 1.9, just under 2 million Illinois residents receive SNAP benefits. That translates to about 15% or 1 in 7 of the population in the state of Illinois. Almost 65% of SNAP households have children. About 41% are in working families, and almost 28% are in families with a member who have an elderly or disabled person as part of their household. When we compare those numbers across the country, the state of Illinois is actually pretty on par with the trends in the country. So like I said, just over 1.9 million adults, or not, 1.9 million Illinois residents receive SNAP benefits. 44 million people across the country receive those benefits, which comes out to about 14% of the population across the country, which is roughly 1 in 7. So those numbers are pretty on par with the state of Illinois and the trends across the country. When we compare the rest of the numbers across the country to the state, again, they're pretty on par with what's taking place both within the state and within the U.S. So almost 65%, like I said, of the Illinois recipients have are families with children. That's 68% at the national level. 28% in the state of Illinois are families who have some elderly or disabled member in their family. That's 30% at the national level. And in the state of Illinois, almost 41% are in working families, and across the country, that number is at 44%. So again, trends are very on par with one another. The other thing that I want you to make note of is that SNAP has kept almost 380,000 people in the state of Illinois out of poverty, 187,000 of whom are children. Now that is the most recent data we have from 2009 to 2012, but if we're looking at numbers, those are significant numbers that this program has a very positive impact on in its effectiveness. So with that, I'm going to hand it off to Alicia to get into the more specifics of the program and then some threats that we see coming down the pipeline to the program. Alicia?
Great, thank you. And just a reminder for folks that if you have additional questions and or if there are additional technical issues that are popping up, go ahead and put those into the chat. We will handle questions at the end, and we will try to be responsive to any technical issues as they happen. So what are SNAP benefits and how do they work? And so SNAP benefits are intended and are used to purchase food. And so they can be used to purchase any type of food, but they can't be used to purchase prepared foods. So that would be things like deli salads. So it's limited to all different kinds of groceries. One other thing to sort of note, SNAP benefits cannot be used to purchase household goods. So things like toilet paper or diapers or other personal care products. SNAP benefits cannot be used to purchase those items. It's limited to food. It can't be used to purchase alcohol. It can't be used to purchase cigarettes. Some of the other sort of misconceptions that happen sometimes. It again, is limited to grocery purchases. And so today, you know, historically, SNAP, when it was food stamps, there were literally stamps. There were literally paper stamps that people used to purchase their groceries. That's no longer the case. So now households receive an electronic benefit transfer card or an EBT card. In Illinois, it's called the Link card. So a lot of times you'll see signs for Link, or people will talk about Link. And you know, it works just like a debit card. And the benefits are loaded on there, and then it can be used to purchase food at any one of the many authorized retail locations around the country. So, and then you can see there sort of the average monthly benefit for household members in Illinois. And then, you know, one thing that we often highlight is, on average, folks receive $1.47 per person per meal. So if you are a household of 3 and you receive SNAP benefits, then, you know, roughly that means you have $4.50 per meal to prepare meals for your families in terms of your SNAP usage, and that's not much. You know, groceries are certainly generally more expensive than that. So people who are using SNAP benefits really have to try to make those stretch in order to be able to feed their families. So the other headline that we really want to get across to folks is SNAP works. It really has a lot of positive impacts, both short-term and long-term. And so we want to just highlight for you some of that data and what that looks like. And so this is just one example of a study that was done. You know, SNAP in the short term, of course, reduces food insecurity, and you know, it also has positive impacts on people's overall health status, on birth weight of children, and interestingly, it shows a positive status on high school completion. And I think that, you know, sort of connects to different things we often talk to around child nutrition, where if you're hungry, it's hard to learn, and it's hard to focus in school and do those things that you really need to do. So there also are long-term benefits, and there was a study that the Brookings Institution did as part of the Hamilton Project that really looked long-term. So they were able to go back and compare populations of sort of groups of people before the food stamp program was implemented several decades ago to after the food stamp program was implemented several decades ago, and then compare those two groups to each other of what their outcomes looked like much later in life. So these people were in their 50s and 60s, and you can see here in this graph that the impact of access to that program during the early life had a significant impact on both their health and economic outcomes. It is interesting, it did seem to have more positive impacts for women than men, and that is sort of a piece of follow-up research that they're looking at to see why that was the case. But you can see it improved health overall, it decreased the likelihood of metabolic syndrome issues, and so metabolic syndrome is sort of a catch-all for things like high blood pressure, heart disease, diabetes, other health issues in that category. And it improved economic self-sufficiency. So it increased the likelihood that, again, later on in life, that you found that these people were able to be economically self-sufficient. So those are some really important and terrific long-term impacts and long-term benefits of the program. Another really important benefit of the program that I think folks don't realize sometimes is the economic benefit. And this sort of illustrates how that works. So you can see the EBT card there. You have a SNAP dollar. Somebody takes that. They go to the grocery store. That grocery store then can hire more workers, and they as they're putting those goods out to folks. In Illinois specifically, SNAP pumped about $3 billion into our economy in 2013. So that is a significant amount of money. It also has, in terms of economic impact, the way economists look at things is, for X dollars, what is the economic impact that it generates? And SNAP is one of the most generative programs in that way. So for every $1 of SNAP, it can generate up to $1.70 in economic impact. It tends to have a greater economic impact when we're in a weak economy, but even in a very robust, strong economy, it still generates over $1.20 in economic impact, which is really important and really beneficial. And frankly, a lot of businesses that work in the grocery, retail, and food sectors, they look very closely at this program because of that. Okay, so now we're going to shift a little bit from talking about what the program is, how it works, who it serves, to some of the potential threats that are out there on the horizon for the program. And one is block grants. And sometimes these have been called opportunity grants. I think there might be other sort of creative names that come up for them. At a really high level, what we want you to take away is that a block grant is equivalent to ending SNAP. And I'll explain why. And so SNAP as it's structured now, one of the reasons that it's so effective is that it is responsive. And it's able to be responsive because it is an entitlement program. And so what that means is that when more people need the program, it's there for them. There aren't waiting lists, that we don't run out of funding. And when less people need the program, that's okay, then it contracts. Economists call that counter-cyclical. It's a counter-cyclical program. So when the economy is good, you see participation in SNAP go down. And we're seeing that now nationally and in Illinois, that participation in the program has declined in recent years. And we would expect that because the economy has started improving. But when the economy gets bad, as it did in our most recent recession, or if in the future there are other economic issues, it can respond, and at that time participation in SNAP increases. If we shift to a block grant, that responsiveness would not be possible because a block grant is a flat amount of money that is given to states and doesn't change over time. And so you can sort of see that graph generically sort of illustrates that people in need goes up and down, the program funding goes up and down with that. A block grant remains flat. And so, Illinois and other states would receive a fixed amount of funding, again, regardless of the need or the state of economy. And overall, that's a bad deal for Illinois. So another issue that folks often raise is, yeah, well, if we were able to cut SNAP, or whatever that cut looks like, if it was a block grant or something else, I'm sure there's administrative waste in the program, and we could just get rid of that administrative waste. And this chart really helps to illustrate the vast majority of SNAP funds go directly to food. And so if you cut this program, what you're cutting is food off the tables of hungry people because there just are very minor administrative costs for the program, and so you would quickly start cutting out food benefits that are available to folks. And that's the bottom line. So one other piece, and Anthony touched on this a little bit when he was talking about the profile of who receives SNAP, but we wanted to dig in a little bit more about what this looks like. It's around questions around SNAP and work, and to kind of dig into this a little bit more. So you can see on the left hand of the slide there that 4 out of 5 SNAP participants either are not in populations where we would expect them to work, or they are working. And so the folks who are not expected to work, so children, we don't, in our current society, we don't expect those kids to work. We expect them to go to school and do other things. We typically don't expect elderly people to be able to work, and we don't expect the disabled to be able to work. Those folks make up 67% of SNAP participants. So then when you look beyond that, more than not, the folks there are currently employed. and we'll talk a little bit more about what that looks like over time. We can go ahead and go to the next slide. Yeah. So here you can see that 3/4, and this is specifically looking at childless adults. So it takes on anybody who would be elderly and not necessarily expected to be in the workforce. It also takes out adults with children because, you know, oftentimes an adult with a child in the household is staying home to help take care of that child. But so when we look at childless adults, 3/4 or 75% of those folks are employed within a year of receiving SNAP. A good portion of them, actually, almost 50%, are employed when they start receiving SNAP. And again, I think that is often a misconception that, you know, there are a fair number of individuals and households where at least one member of the household is working. And, you know, even you could have a full-time job, but if it's low wage and you have a couple of people in your household, you can still qualify for the program because, you know, you're not making enough income to make ends meet. And so there is often a disconnect, but, you know, again, many people in the SNAP program either are people that we would not expect to be working in their lives, they are currently working, or they end up working, you know, very shortly within the beginning of receipt of SNAP benefits. All right, so one last policy issue, one last threat issue that we wanted to discuss with folks, and this is time limits. And sometimes these are referred to as work requirements as well, but really what they amount to are time limits. It's a particularly unique and harsh federal policy. So in Illinois right now, we do not have the time limits, and we'll explain a little bit more about why that is. So currently for Illinois, that time limit is waived statewide until the end of calendar year 2017. That could change in 2018 depending on both how some data looks and also decisions that the governor's office makes, so we'll talk about that. So what is the time limit? So the time limit applies specifically to able-bodied adults without children. In Illinois, we estimate that at a minimum there are 250,000 people who would fall into this category. At a maximum, there could be up to 400,000. The state's data is a little iffy, on this population, but it's somewhere in that range. But so what it means for these folks is that they would be limited to receiving 3 months of benefits during a 3-year period unless they're meeting certain requirements, like working in school 80 hours, working or in school 80 hours per month, which averages out to roughly 20 hours per week. So a couple of things I would note here. So there's no requirement for folks affected by this time limit. There's no requirement that anybody tries to help them find employment or they get connected with any services that could help them with this. It also can be really challenging because, you know, oftentimes folks are working some, but they might have trouble hitting that 80 hours per month on a consistent basis. And so that also creates a challenge because then they end up dropping off if 1 month, you know, their hours are down, they're not getting as many shifts perhaps and whatever their work is. And so there are a lot of challenges around this. So a little bit of additional context about why Illinois specifically does not currently have a time limit. So states, this is something that states can sort of select and have an option to them depending on what unemployment looks like in their state. So states have the option to waive this time limit when unemployment is high because that typically means there's not enough jobs available, so it's not fair to impose that time limit. And you know, in 2018, we do anticipate that Illinois is likely to no longer qualify for that waiver statewide because unemployment is starting to go down. However, we do believe that significant parts of the state would continue to qualify for it because unemployment is actually still pretty high. And again, you know, not fair to have a time limit when, frankly, there just aren't enough jobs for the people out there that are looking for jobs. Other states have begun to reimpose this time limit as their economies are improving. You know, and frankly, what we see is that it results in a lot of people getting cut off of benefits and you know, losing access to that important thing that can help stabilize their lives, can help make sure they're hungry. You know, and we understand sort of the goal of wanting to help connect people with work and help them reach that self-sufficiency, and we absolutely agree with that. However, I think an artificial time limit is not the most effective way to go about that because, you know, if somebody is hungry and they're sort of struggling to meet that basic need, I don't think that makes it more likely that they're going to magically find more hours in their job than they have, or magically find a job, you know, that offers them that stable full-time employment that they need. Again, Illinois has qualified and applied for this waiver since 2009. We have it through the end of 2017, but this is going to certainly be up for discussion and an issue in 2018. And we want to highlight this for folks because this is something that the Food Depository and our partners will be advocating on. And I will say it's a little bit of a tough issue to advocate on just because it's complicated. There aren't always, sort of the simple talking points there on this. But at a high level, again, we really encourage the state to take advantage of whatever waivers are available to us so that people living in areas of the state where there is still relatively high unemployment are not subject to this time limit at this time. A couple of SNAP resources listed on here. Of course, there are tons and tons of resources out there on the internet and also on the Food Depository's website around SNAP that folks can access. I think as Anthony mentioned at the beginning, we'll be posting both the slide deck and a recording of the webinar on our website. So folks will have, if you get access to these slides and download them, you would have these SNAP resources there available to you. All right, so here's a fun part. So what can you do to help? And there's a couple of different things on here, but one that I would highlight the most for folks is talk to people about what we talked about today. I'm guessing for every person on the webinar, there's a different takeaway. For some of you, you might be surprised about how the program works and and how you can use your SNAP benefits. For somebody else, you might be surprised to know how many people on the program are working or find work pretty quickly within receiving benefits. So, share that information with your friends and colleagues, because one of the things that you can do as our partners and supporters is really help dispel myths about this program and really help spread the word that it is truly a vital hunger fighting program, and it's incredibly effective, and it has important long-term impacts for children, the elderly, and everyone that we serve here in Cook County. A couple of other things, please make sure you're signed up to receive our emails. So, and that makes sure that you get our advocacy alerts as well. So Anthony mentioned, the federal update on healthcare. Will actually be sending out an advocacy alert either later today or first thing tomorrow morning, encouraging folks to reach out to their members of Congress about that, because, again, asking members to oppose the legislation as it stands because it would significantly reduce access for low-income households. You can also learn who your elected officials are by visiting our website and click Find Elected Officials. It's always kind of good to have a sense of who's out there representing you. And last but not least, you can sign up to be a champion advocate, and that's also from our advocacy page on our website. And what this means is you would get put into sort of a group of folks who you get a little bit more information from us and on a little bit more regular basis around advocacy. This isn't for everyone. For some folks, periodic updates are sufficient, but for folks who are more into advocacy and you want to get every update that you can and be a little bit more involved in this work, this is a good opportunity for you. So you can go and visit that website. The other thing, we talked about this during our last webinar, but we just want to remind folks that our 32nd annual Hunger Walk will be happening in September this year. In September, of course, is Hunger Action Month. It'll be Saturday, September 16th. In Jackson Park. It's a hugely important event for us. It has an advocacy focus. It's, we think of it, it's sort of where we rally all of our supporters to really raise awareness about the importance of fighting hunger, and we're in the process now of thinking of some pretty cool and fun things for folks to be able to do while you are there at the Hunger Walk. So if you haven't already, save the date, put that date in your calendar, tell your friends, but start thinking about pulling your team together now. All right. So we have come to the end of our presentation. If folks have any questions, we're going to leave people in listen-only mode because we find that if we open up the chat, we sometimes get weird feedback and other things as folks' phones play off of each other. But we will give people a couple of minutes here to add or input your questions in the chat. Just scroll up the chat to make sure we didn't miss any questions from folks other than our technical assistance stuff that came up. I don't see any more questions going in, so we'll give it a couple more seconds. But while we do that, again, both the slides and a recording of this webinar will be posted to the Food Depository's website either sometime tomorrow or early next week. So another thing that you can do is share that with folks. So if you're, say, an associate board member and you knew somebody who was planning to join but couldn't, you can share that with them or remind them that that's available. You can share it with folks who you think could benefit from the materials and might be interested. Our next webinar will be at the end of June. We're right now planning to do these every other month, and so we will send out a date for that as soon as we set that. And again, I think the structure moving forward will be sort of similar to this one, where we start with some updates just about what's happening at the federal and state levels, and then the other happenings that we want folks to know about. And then we'll pick a program area to do a little bit of a deeper dive on. So a different one than this time. So this time we focused on SNAP, and in the future we'll pick a different area. So thank you everybody for making time during your busy days to join us for this. We really appreciate it, and have a great day.
Thanks everybody.